Hi everyone, welcome back to another video, and today we're picking up again talking about abortion and pregnancy termination, and today we're talking about HELLP syndrome, which is very similar to preeclampsia. So if you haven't watched that video already on preeclampsia, I suggest you go do that, because these actually used to be lumped together in the same category, but recently, since we've kind of discovered that HELLP syndrome has a little bit different pathophysiology than preeclampsia, we're starting to differentiate them more than we previously have been. So we're going to talk about HELLP syndrome on its own today, and I'm going to kind of explain the process of HELLP syndrome before I really talk about what this means for pregnancy termination and why you would need to deliver a baby earlier than term for this condition. So HELLP syndrome is similar to preeclampsia in that it does involve the placenta. So we have our placenta, and the placenta needs to form these spiral arteries in the uterus to connect the placental blood supply and the baby's blood supply to the parent's blood supply. You need these channels to be able to have effective perfusion of the baby, to have adequate oxygen supply to the baby in order to allow it to grow and develop. So we develop these spiral arteries, and they need to be wide enough for blood flow to go through. And if you remember in my preeclampsia talk, we talked about how the spiral arteries in preeclampsia get narrow, and so you get high blood pressure and you don't perfuse well between the parent and the baby. So this is kind of similar to that. This is another issue with the spiral arteries, but it's a little different in that this is a largely inflammatory process. So we don't know exactly how these spiral arteries get messed up. So something might happen related to genetics. It might be related to some other inflammatory type condition, but something happens to where these spiral arteries don't modify themselves in the way that they need to provide adequate blood flow between the parent and the fetus. So you get these inflammatory mediators coming out from this problem in the perfusion. So you get hypoxia in the baby. You're not perfusing well, not getting enough blood flow, not getting enough oxygen to the baby, and you're going to produce inflammatory mediators. So things that would signify to your body that you're sick or that you have some kind of response that your immune system needs to activate. So you release these compounds that are going to stimulate inflammation within the body, and these mediators actually do a lot of damage to blood vessels. And blood vessels, of course, connect the placenta to the baby. It connects the baby to the parent, but it also, of course, the parent has blood flow and blood vessels between every organ in their body. So if you're damaging blood vessels, then you can cause end organ damage and a lot of problems. So these inflammatory mediators, they can go to the liver, they can go to the kidney, they can cut off blood supply in other places. It's going to cause a lot of injury to blood vessels. And so this is the foundation for this issue. So HELLP syndrome is actually an acronym for the symptoms that present, or the issues in the body that are injured by this inflammatory process. So the H stands for hemolysis, so the rupture of red blood cells, and this can cause anemia. If so, you have a certain amount of red blood cells in your body providing oxygen to you and to the baby, but these are going to be destroyed in this inflammatory process, and when they are destroyed, you get anemia. You're no longer able to provide enough oxygen to your body, and so you might feel nauseated, you might be pale, you might have just overall feelings of illness with this. And you can also have some other more severe problems with hemolysis as well. But the foundational process for this hemolysis, you have blood clots that start to form from this inflammation. It stimulates your platelets to coagulate. So you're going to have a clot form in your blood vessels, and then when your red blood cells try to pass through this blood vessel now, they're going to have to squeeze by this clot that's taking up most of the space. And as it squeezes past the clot, they're going to break apart because they're going to be sheared by this clot that's in the way. So you get these blood cells that are now torn apart, and now they're floating around in the body. They're all torn apart. They can't really hold much oxygen anymore. They're not really helpful. So this is how we get hemolysis from vascular injury. The next two letters, E and L, represent elevated liver enzymes. So you have blood flow that's getting cut off now to the liver. Since I mentioned we had this vascular injury, and it's going to affect the blood vessels going into and leaving the liver. So as blood tries to get to the liver, it's not going to be able to be very successful because we have this inflammation of the blood vessels. So you can get liver failure. So elevated liver enzymes signify damage to the liver. So you're getting liver failure in this process, and that can be very dangerous. Of course, you don't want your liver to fail. Your liver's a primary organ for detoxifying your body of drugs and other such compounds. So you need your liver, and your liver is also responsible for producing coagulation factors. So your liver won't be able to help you stop bleeding from happening. So that can be a huge problem. So you've got these elevated liver enzymes that signify this liver damage, which is a type of end organ damage in this case. And then L and P are for low platelets. And this goes back to our blood vessel damage here. So when we have these platelets being activated by the inflammatory mediators produced from this vascular injury, it consumes the platelets. So you have these platelets that are all getting caught up in these clots because they're all being activated prematurely when they're not supposed to be activated. They're coagulating, they're creating these clots. And so now the platelets that should be used for other things, like if you were to get a cut and you need your platelets to help stop the bleeding, they can't anymore because they're all used up here. So we call this a consumptive coagulopathy, and this can cause bleeding. So this can be a problem, of course, because if you get a minor injury, you could actually bleed out, and it could be very dangerous in that. So what do we do? How do we treat HELLP syndrome? Since this is an issue that is related to blood vessels, the spiral arteries of the placenta, this inflammatory process is going to continue as long as the placenta is there and as long as the fetus is there. So the only way to treat somebody with HELLP syndrome and to prevent complications of HELLP syndrome is to induce delivery of the fetus. All of this ends with delivery of the fetus. So the recommendation for HELLP syndrome is to induce delivery at 34 weeks gestation, or even earlier if you're having significant problems with the parents. If they're unstable and it's an emergency, you're going to have to deliver earlier because, of course, if a parent is bleeding out on the table, you want to do everything in your power to make sure that they don't die. So that might be a case where you're going to need to deliver earlier than 34 weeks. And again, looking back at our timeline, 34 weeks is still viable. It's technically after 20 weeks, so it is considered viable, but it's still not term. It's not 37 weeks. You still have a higher chance of fetal death at 34 weeks if you deliver. And then, of course, anything earlier, you're going to have significant risk of fetal death. So, in this case, you need to deliver to save the parent, and sometimes that involves delivering the fetus even when this fetus may not be viable or may not survive. So, again, this is another issue where the legality of abortion and termination is very unclear, and it's very problematic to pass these laws that are going to penalize doctors and penalize parents for having to deliver a fetus before viability. And I think we need to take more caution with passing these kinds of bills. And as I'm showing you multiple videos now, plenty of reasons to do this. So please think before you vote on these issues. Make sure you understand the science before making these kinds of decisions. And I will see you all in the next one.